As monkeypox spreads in the U.S., so does its impact. And joining us tonight is Kevin Munoz. He's the Assistant White House Press Secretary. Thanks so much for joining us.
Thank you.
So the White House says 1.8 million vaccine doses will be available for order starting today. So what's the plan to distribute all of those doses?
So that's exactly right. 1.8 million doses on top of 1 million vials are being provided to cities and states and jurisdictions across the United States to really ensure we're ramping up our vaccination effort across the country. We know following the FDA's decision just a couple of weeks back that we have a safe and effective mechanism to vaccinate fivefold the eligible population that we were originally conceiving with our existing supply. So this is a game changer in terms of our ability to get more Americans, especially members of the LGBTQ community, vaccinated as quickly as possible. We're also working really closely with our partners across the country, especially in areas like Charlotte, where they just had Pride, to provide additional vaccines based on needs. We know that's another way we can be really impactful here.
And that kind of ties in with our next question. So just this weekend, as you were saying, Charlotte, North Carolina was the first place to receive extra doses for an LGBTQ event. So how did that vaccine rollout go there?
So we've been planning for this moment for months now. We knew that at the end of the summer, as we scaled up our vaccine access, that there were also these large events, Pride events, including in Charlotte, including in Atlanta, and including in New Orleans, that we could really target our efforts, not just for vaccines, but also for testing to ensure that members of the community understand the risk of certain behaviors right now. And so we're really excited that with Charlotte, that was our pilot program where we provided up to 2,000 doses ahead of time so that they could vaccinate people and ensure that they were getting that vaccine back so they can continue their campaign in the days ahead. We went really working with the local public health department, and we're going to continue doing this throughout the summer.
And there have been at least 3 monkeypox cases confirmed among children in the U.S. as well. So how concerned should parents be right now, especially as they get ready to head back to class?
So the overwhelming majority of cases right now of monkeypox are among men who have sex with men and bisexual men. This is really overwhelmingly where our focus must be as a country, because we know how to end this outbreak is to work really closely with that community to stop its spread. You're going to see some isolated cases of monkeypox just because of the nature of how any virus spreads, but the risk is incredibly low to individuals that are going into school, these little kids. We know the CDC has provided some questions, helpful answers and questions to some of the things that people are asking about right now, but the risk is very low.
Good information there, especially as parents just get ready to send those kids back to school. There's lots of things to be worried about, and this makes it a little bit easier. Kevin, thank you so much for your time. I appreciate it.